Hi, everyone, and welcome to our presentation, Building Strategic Free-Roaming Cat Management Programs with examples from Bulgaria and Thailand. I'm Tamara Kartal. I'm the Senior Manager for Stray Animal Care, Monitoring, Evaluation, and Impact globally at PAWS International. And I'm joined today by my lovely colleagues, Pom and Ivet, who are going to talk about our data collection that they managed in Thailand and Bulgaria, respectively. In Bulgaria, there has been a lot of progress and real success in managing street dog populations humanely, especially in Sofia. However, cat management is something that only recently has become really a focus. So PAWS, together with the municipality of Sofia, has been working on humanely and strategically managing cats for the last couple of years only. But I think important to know is that there's not really a directive how to manage cats in Bulgaria, nor are cats really protected by law at the moment. That also means, and which is, I think, a good thing in many ways, that they are also not part of the shelter population, at least not in the public shelters. They generally don't have cats. You will have private rescues and people who obviously care for animals that are injured or need help or can be adopted out, but that is not something that the public shelters do in general. So I just wanted to give you a good overview of what we've done since last year. So really significant data collection started last year with a survey of the veterinarians who are a key stakeholder we're engaging with. And then the other one is a transect survey of the city of Sofia using a photo marker capture approach. This year, since it's warmer again, we started intensive photo marker capture surveys in Sredets in Sofia, which is a neighborhood. And we've started to conduct a representative household survey, which is a knowledge, attitude, and practices survey of Sofia in regards to stray care practices and attitudes, but also in general what the cat ownership rate is across the city. And that will be followed this month with a representative knowledge, attitude, and practices survey of cat owners in Sofia to really understand behaviors and practices, but also attitudes that are can be helpful or hindering in a cat population management project. So I'm going to talk a little bit more about what we've done last year, and Yvette is going to follow with the veterinary survey. So how did we do or start the survey in Sofia, which is a big city, and like any other capital city is beautiful, but also complex and has a lot of neighborhoods. So as you can see here, Sofia has 24 districts or neighborhoods, and we, as a starting point, used these obviously as our survey units, but also tried to stratify them with things that we think influence or drive cat population size, densities, or dynamics. So really looking at different things that we think are important to acknowledge and be accounted for in our survey. And that the results really give us a macro level view of the densities, but also how the cats literally map out across the street. So we came up with 3 categories that we use to stratify the city. And the first one is human density, really looking at what is the human density within these districts. And then the second one was the proportion of green spaces, because what we found is that in general, green spaces in the city center of Sofia, there are not many cats there because the common practice for dog owners is to let their dogs be off leash in parks. That just makes it really less attractive for free roaming cats to be there. That being said, obviously there are also exemptions. So if you have a stadium or any other big building, there might be a cat colony. But in general, the assumption is that these are pretty cat-free. And then the third category was housing types, so which is displayed here on the map. So really looking at what does the physical environment a free roaming cat would encounter be like in these neighborhoods, and does that really matter to cats? We assume yes, but we will see what our results show. And for this survey in June 2023, we really looked at the city center. So the green parts here, which is called peripheral districts, that are a little different in the setup and size. We surveyed a couple of transects there, but that will be a different layer of surveys as well. So we've really focused on the central part with some in the peripheral areas. So what was our survey method? We used to survey the areas by using photomark recapture along transects because we really wanted to capture the nuances in the city, but also be able to use statistical models to extrapolate to all areas within the city, but also within the strata. So we surveyed, as you can see in the gray lines, we surveyed a total of 24 transects across 14 districts, our neighborhoods, and a minimum of 3 times we repeated those transects with the photomark recapture approach. So that means that we had teams of 2 walk along these transects and record all the cats that they encounter. For that, we used the Thalia app for all the details and a different device to capture the cats with photos. We encountered 1,119 individually identifiable cats on 95 survey events over the period of 2 weeks in June 2023. The number of unique cats observed varied between those 3 visits and on each transect, which is consistent with count-based data collection designs, so was very much in line with what we expected. Results-wise, considering how difficult cats are actually to survey compared to dogs in some places, we used the Bayesian model, which estimated an inclusion probability of omega 0.49, which means that over the 3 visits to a transect, about half of the cats that occurred there were detected at least once. The detection probability was estimated to be at 0.131, meaning that a single survey of a transect, we would detect about 13% of all cats that are available to be recorded. And combining these two, then we actually can collectively interpret that we see about 1 in 16 cats that occur on these transects will be then observed on a transect during a single visit. Key findings were really that the results showed that the number of cats per linear kilometer or roadway was highest in early to mid 20th century districts, which you can see here are yellow, followed by city center districts and social housing districts, and the lowest cat density we saw in peripheral districts. On the right side here, you can see the cat densities that we found in the districts that we surveyed. So just to wrap up, so as I said earlier, the cat population in Sofia and probably elsewhere in Bulgaria is either on the street or in homes, and likely a high percentage inhabit both spaces to various degrees and length of time. So therefore, sterilization or TNR efforts are very much linked to the community caretakers and the private cat owners. So to reach them, the biggest advocate and the first to advise is, like in many other places in Europe, really the veterinarian. And I will give over to Ivet now to speak in more detail about that key stakeholder and what our research found. Thanks so much.
Thank you, Tamara, and hello, everyone. My name is Ivet Balchiklieva, and I'm a Community Engagement Coordinator for PAWS International. At PAWS, we recognize that cat population management requires a multifaceted approach, and one of our goals is to understand the stakeholders involved in the process. This is why we conducted a survey on veterinary attitudes towards neutering in Bulgaria. Similar studies have been conducted elsewhere in other countries, but never in Eastern Europe, and more specifically, never in Bulgaria. Our aim was to discover what is the recommended minimum age for neutering of cats and dogs, what are veterinary attitudes towards early age neutering in particular, and what, if any, are the perceived barriers towards early age neutering as well. We conducted 204 phone interviews and 120 web-based interviews. After data cleaning, we had 321 veterinarians working with companion animals in Bulgaria. The survey was conducted in the period May to August 2023, and it received ethical approval from University of Winchester. Now I'm going to take you through some of the results. As you can see from the graph and the results that are displayed on the screen, when we asked the vets about whether they recommend neutering to owners, we received quite positive results, with 68% of them reporting that they always recommend routine neutering of cats to owners. More importantly, even higher percentage, 83 to be more exact, recommend that they always recommend that owners always neuter cats with outdoor access. When it came to neutering age, however, as the graph displays, 75% of vets reported that they never neuter cats before 4 months of age, and another 58 rarely or never neuter cats before 6 months of age. Both the recommended and the actual neutering age was 7 to 11 months, regarding of the cat's sex, being stray or owned. In general, the results showed that vets in Bulgaria are not supportive of early age neutering of cats in particular, with 86% of them reporting that they would not recommend neutering of cats before 4 months of age. The main reason was reported to be that the cat is physically not developed, and this reason was followed also by ethical concerns. Earlier neutering, it's not even recommended for owners who have multiple cats of opposite sexes. When it comes to pregnancy and neutering, 58% of the vets that were included in our sample report that between 1 and 50% of the cats that come into their practice for neutering have already had a litter. Moreover, 1/3 of the vets, as displayed on the pie chart on the screen, would not be willing to neuter a pregnant cat, regardless of the stage of pregnancy. These results suggest that there might be an increased risk of accidental litters, given that some female cats can reach sexual maturity as early as 4 months of age. And although the results suggest that veterinarians in Bulgaria seems to be supportive of routine neutering of cats, in particular, and they would recommend it to owners, they are not very supportive of early age neutering, which means that there may be some more information required on the subject and a bit more support when it comes to early age neutering. Thank you very much. I am now handing over to our colleague Pom, who will tell you about our cat project in Thailand. Thank you.
Hi everyone, I'm Chonnikarn, Phochanakij, or you can call me Pom. I'm a stray animal care project manager for Southeast Asia. I would like to share my experience conducting cat population surveys, especially in Thailand today. As a cat lover, of course, it's one of the best experiences in my life. And it's a good learning curve for me as I'm in this field. I have learned so much how to spot the cat, how to collecting the data, how to be able to utilize this data for the larger scale. Let's begin with this image of the place where we select to do a population survey, which you could have guessed like why there's so many monks walking around. They're not just there for doing meditations, but they are there looking for their cat who actually under their care and has been sterilized and vaccinated as a part of population control in a sustainable way. The team is working together with our local partners, which are Bangkok Cat Society, who we then identify what Tat Thong as our target area. The temple is situated right at the center of Bangkok, but the sad truth is temple is a place where people abandon their animals because they rely on the kindness of the monk and their way of leaving and forgiving people and don't hold a grudge against anyone. So apart from that, then the stray cat have been fed by local peoples who are residing in the back of the place. In this image, you can see the local communities setting in the areas, which most of these people adopted a stray cat after they were abandoned by the outsider. Despite their own poor housing, they extend their kindness to look after this cat. So what we try to do is we try to apply evidence-based approach to carry out exploratory researches. This is result in the finding of cat population dynamic as well as help the preparation of mobile clinic that we want to set up. The team gained support from monitoring and evaluation expert like Tamara, who presented earlier, and who also designed a baseline survey tool for us and being able to enable us to do data collections. Of course, in this area, there's a really large compounds consisted of some governmental office, some school, and we have community, as we mentioned before. Over the 3-day course of survey period, we managed to interview lots of local people and local feeders and gain their input as well for our whole survey. After we complete the survey, we aim for 70% for the first round of TNVR. And after the event, then we plan to repeat the free roaming cat surveys to provide accurate data on number of sterilized cat. This will help proving the efficiency of the population management in the future as well when we look back at it. And as you can see as well from the image now, we identify cat in different categories or be able to provide and tailor the program accordingly. We find it easier to handle own cat, of course, in the area when it need so much effort for the team to catch them or trap them. And the monks is always give us support as well. So we get support from the monks catching all the cat or trapping the cat for us. Also, we found some feral cat as well, and this is the toughest one to actually catch. And we try to, throw a lot of different taste and flavor of snacks just to find out which one is their favorite, so we can come back with that one again. Of course, as a part of our activity, we want to educate people about TNVR. So we learned about TNVR that's pretty much just try to avoid giving them the myth or just pretty much just make the myth disappear just at appropriate age for animal to get TNVR, and all sexes of animals should get sterilized regardless of male or female for better health condition, of course. And also they will be more aware of what TNVR could help to reduce aggressive behavior, as less concerned about sterilized animal roaming around. Some of them were complaining that they can't identify their cat at nighttime, something like this. Also for some female animal would run risk associating with reproductive health as well. So this is something that we try to get them to think about and think about the benefit as much as possible and spreading the word as well. So what happened is, here's again a summary recap of what happened at the mobile clinic after we gained all the input from data collections. And also we gained the trust, which is really the core of these activities. So we get support and trust for local people, and they are willing to help out throughout the whole process. Briefly, what we try to apply is using the tool that is available for us. We apply a Picolet 5 and Talias, with pretty much just being able to record physical appearance, the location, sterilized status, and their health condition as well. So just go through this briefly in pre-surveys results. We found that unsterilized status is quite high, up to 78. As mentioned, we found cats that are semi-owned by local people because they've been able to pinpoint which one, and stray animal without collars. So pretty much add up to 83% of the whole population in the area. And they also find it hard to get TNVR for their cat, most likely that's what local people said, because they're not available on the weekday. They're available clinic only open on the weekdays, and they really heavily rely on the clinic that they can reach. And as you can see from the graph, it shows more cat was seen in the street in the morning than the evening time. Maybe they're less disturbed by that time. Even though many cats had unknown sterilization status, it seemed that a high percentage of sterilized cats were found compared to before. After averaging the result of all surveys results of the event, the overall sterilization add up to 44% in comparison to 78% unsterilized rate in pre-survey result. So to wrap this up, we got positive result. We managed to sterilize 106 cats over the course of 3 days. 2 days, and that account for 76% with support from our local partner, of course, we mentioned before, and Thai Animal Welfare and Bangkok Cat Society. They managed to make a difference from 8% at the beginning, as you can see from pre-survey result. So we also distribute satisfactory surveys to people who took their cat to the clinic, and people in among they shown high satisfaction number, and they would like us to run mobile clinic at least twice per year as a result of how we combine the population's survey data and tailor the mobile clinic accordingly. During the event, of course, our team and partners had strengthening our capacity as well. It's like learning on the spot, training on site, which pretty much gaining practical experience for everyone in the team. And finally, we hope to reach our ultimate goal to make cat happier and healthier, of course, especially in this kind of setting. And we know that it's going to be hard for us to stop people abandon animal at the temple, and this is a solution that we can provide. And we expected to run this kind of event again in the same temple or different location where we can fill the gap and then collaborate with our local partner as well as local government and the other agency. Thank you.